Welcome to ADHD Realities, where we dive into the intersection of ADHD, relationships, and sexuality. I'm your host, Leanne Borneman, certified sex therapist and sexologist, and fellow ADHDer. Today, we're diving into a topic that comes up a lot, but then isn't talked about enough: porn use, compulsive behaviors, and how ADHD can make this even more complicated. We'll cover common misconceptions, how ADHD and dopamine seeking behaviors intersect with porn use, and how to navigate this in a way that promotes self compassion and healthy relationships. Plus, we'll talk about when it's time to seek professional help and how partners can work together when porn use becomes an issue. Let's get into it. All right, so let's start with the important thing here, right? Because porn use is actually a very normal part of sexuality for a lot of people. And you can have your own belief system, but it is a very normal part when it comes to people's engagement in sexuality across the board. But when does it become something that's problematic, right? So for those of us with ADHD, our brains are wired to seek novelty and stimulation, amongst other things. And we naturally have a lower baseline when we're looking at dopamine. And I think it's really important to remember that even though that can be such like a medical related explanation, everyone is different with their experiences when it comes to the wiring of our brains and how ADHD is going to present in your day to day. So for some, we're constantly going to be looking for ways to boost the dopamine, right? Whether it's binge watching TV, impulse shopping, my favorite, or using porn. Our brains can latch onto whatever gives us that quick hit of a pleasure. But ADHD also then comes with impulsivity and difficulty with the self-regulation piece due to those deficits associated with our executive functions, which then can make it easy to slip into some patterns or overuse porn without even realizing it. So what I want to kind of focus on today is about how to recognize when porn use is just like that normal part of your sexuality versus when it might be something that needs a second look. Okay. So let's be clear and clear up a huge misconception right away. Porn addiction is a controversial term. Some people use it to describe compulsive porn use, but when we look at the DSM-5, which is the diagnostic manual that many clinicians are using to help determine, like, do you fit criteria for a certain disorder, the DSM-5 doesn't actually officially recognize it as an addiction. And one of the reasons for this is because unlike substance addiction, where there is this physical dependency, compulsive behaviors like excessive porn use tend to be more about impulse control and emotion regulation. Now, I'm speaking from where we currently sit and stand with the information around this. Whether we see something different as we progress in better understanding this topic is a totally other topic. So please understand, I'm bringing you that objectivity here. Another common misconception is watching porn in itself is inherently harmful or immoral. And the reality is, like any form of media consumption, it depends on how it's used. So many people watch porn without any negative consequences, while others may struggle with compulsive use due to like this underlying emotional, relational, or neurological factor that's tied to it. And there's this also belief system that people who watch porn excessively have no self-control or are morally failing. And in truth, compulsive porn use often stems from unmet emotional needs. It's from stress or, yes, even coexisting mental health conditions like anxiety, depression, or maybe even trauma. So when ADHD is involved, the impulsivity and that difficulty regulating emotions makes it even more complex. To further the train of misconceptions here, another big one is that quitting porn entirely is the only solution. While some people may choose abstinence, for others, learning mindful consumption and setting boundaries can be more effective than trying to ignore it and erase it completely from your life. It's really a lot about figuring out what works for you and addressing the root causes of any compulsive behavior rather than just demonizing porn itself. I would be doing you a disservice by not also mentioning the guilt and shame cycle that comes with these misconceptions. So when we focus on individuals with ADHD, we're already prone to struggling with self-worth because of our development. And again, you can't say that across the board, but I have yet to meet one client and or person with ADHD that has not struggled with this concept of self-worth. So add in messages that you're bad or you're broken for needing to watch porn or using porn. And you can really create that recipe of internalized shame that makes everything worse. And the truth is, struggling with compulsive porn use doesn't make you weak or perverted. It makes you human. And more importantly, it means you're dealing with unmet needs that deserve compassion and attention. The last thing I want to touch upon as I'm talking about these misconceptions that just really hold weight on then that shame and that guilt and how we're feeling is that all porn use automatically leads to negative effects on the relationship. Now listen, while excessive, secretive, or compulsive porn use can cause tension, it's not inherently damaging. What matters most is how it's approached within the relationship, the perceptions you hold about porn and, quote, proper use within the relationship. Whether there's transparency, whether it aligns with personal or shared values, and whether it's interfering with emotional or the physical intimacy you're trying to meet within your relationship. I can't stress enough that the open and judgment-free conversations with your partner about expectations, about boundaries, can go a very long way when we're talking about preventing misunderstandings and, more importantly, creating better and deeper connections instead of the conflicts within your relationship. And I can't tell you how many clients that I have worked with thus far around this topic of, quote, porn addiction, that a lot of the times it isn't necessarily a compulsive related behavior. It's more about you feeling or thinking that your porn use is bad, therefore you're labeling it as such. And so there's two different lenses, two different experiences here, right? It's the individual that sees their porn use as bad, and so you're using this label as if you're addicted, versus individuals who are indeed struggling with compulsive related behaviors and that impulsivity and that self-regulation piece that holds a deficit where it is indeed causing significant distress in your day-to-day functioning because of it being that compulsive-like behavior. Now, I want to dig into the science behind ADHD and compulsivity. So our brains crave dopamine. And we're going to chase after whatever gives us that reward. Whether we perceive it as good or bad, it doesn't matter at the end of the day. It's about, is our brain getting what it wants? If it's getting what it wants, it's going to want more. So for some people, that could be a video game, right? We know a lot of people like that. It could be social media. I admittedly have to say social media is my freaking kryptonite. And for some people, it can be like food, snacking. And guess what? For others, it's porn. And I gotta be honest, it makes sense. Porn is easily accessible, it provides instant gratification, and it gives novelty our brains love. It gives stimulation that our brains love. I mean, when you really unpack the five senses, porn is literally penetrating all of those senses. No pun intended. But with that aside, here's where it can become a problem. So when stress, boredom, or emotional dysregulation starts to kick in, we can start relying on these quick fixes more and more. And instead of then dealing with like what's really going on, that is then how and where the shame spiral will really start to pick up for a lot of people. And so then porn becomes the use to escape. You use it, you feel guilty about it, and then you use it again to cope with the guilt. It becomes a vicious cycle, and it becomes very automatic. And so this is where like a lot of people feel possessed or not in control. And it's really then unpacking the cycle, trying to break the cycle, right? And part of that then is definitely figuring out, well, how do you chip away at the guilt? How do you change guilt into empowerment? Where is the guilt coming from? This is very psychological, 100%. But again, we have to be mindful of how ADHD can play and feed into this as well. So when we talk about ADHD, it can also make it harder for us to regulate urges in the moment, right? Our executive functioning challenges mean we struggle with the impulse control, which is going to make it harder to stop once we start. And then that hyper-focus aspect of ADHD can also play a huge role. And so what might start as casual use can actually quickly escalate into binge watching or excessive consumption, simply because transitioning away from something that's stimulating is difficult for us. Because guess what? A lot of us can also struggle with the ability to transition from one thing to the next. It's a cluster. It is a cluster. And another piece of this puzzle is the emotional regulation. Many people with ADHD use porn as a way to manage stress, to manage anxiety, and even to manage rejection sensitivity if somebody is experiencing that. It can feel like the safe and reliable way to self-soothe, especially when other coping mechanisms are underdeveloped, or the coping mechanisms you've been told to try to use are asking you to use brain processing, right, that you have deficits in. And so it's set up for your failure, not your success. So you go with what you know works. And unfortunately, when we rely on porn as the primary coping tool, it can create then that unhealthy cycle where we never actually address the underlying emotional needs. And again, shame kicks in. You keep it your secret. It's your baby. You don't want anyone to know. You're going to be judged. You're going to be ridiculed. And that's another reason why tons of people, generally when I get my clients, I am like the 4th to 6th stop for my client. I'm like the last resort. So if all of this sounds familiar, you're not alone in this. And that's why I wanted to talk about it. How can we break that cycle? So how do we move then from compulsivity to conscious choice? The first step is self-awareness. Start tracking your patterns. But let me tell you something. That's easier said than done, because for us ADHDers, depending again the significance of our deficits, self-awareness is one of the deficits. And so we really have to put our ADHD lens on and understand that this is going to be hard. This is going to be hard to approach self-awareness because of that deficit. So understand self-awareness in the moment will be a lot harder for many of us ADHDers. We're generally better at self-awareness after the fact when we're thinking about things. Like it's the moment of like, oh crap, I like really dominated that conversation. Or I should have said this. I wonder if they're thinking this, right? Where our strengths are within self-awareness generally is after the fact, not during. So with that being said, I would love you to ask yourself, when are you using porn? Is it tied to boredom? Is it tied to stress? Are you avoiding something? Once you can start recognizing the triggers, you can start shifting your approach, or at least creating the mindset to help you get into the path of shifting your approach. Instead of falling into like that cycle of shame, try something called mindful consumption. So mindful consumption is this practice of being intentional and aware of what you consume. It's going to involve making choices that actually align with your values, your needs, your well-being, rather than acting on impulse or like any external pressures. Another layer to this then is going to be identifying like, what are your values? What are your needs? There's a big difference between feeling in control of your choices versus feeling like you have no say in them. And that's really important to understand and remind ourselves. Another helpful strategy, if you're trying to begin exploring, is finding other ways to get dopamine boosts. And I'm well aware tons of people talk about this, and I'm sure you roll your eyes because, yeah, it takes energy, it takes effort, and I gotta be honest with you, I get it. It's exhausting, but we also have to get into the space of, okay, well, do you want change? Do you want this, right? Well, what do we have to do? And if you're really struggling with it, it's the question of the why. And this is where, again, I always say, don't try to be your own superhero. If you have the ability and you have the resources, work with a qualified professional to help you through these because it is exhausting. And my ADHD just got the best of me, and we kind of took a tour here. But back on the dopamine, right? Finding other ways to get your dopamine boost. Maybe it's the typical exercise. If you don't like exercise, that's fine. I don't like exercise, not where I get my dopamine boost. You can find a creative hobby, something that you really like feel stimulated in. I had a client once tell me recently about how they actually love doing puzzles and like outside the box thinking. It's like, I don't understand how and why it like just pulls me in the way it does. Well, for that person's brain, it's stimulating. It feels good. You're giving your brain what it's looking for, right? But the point of all of this would be to really try to find something that you're introducing that's novel, but not in sexual ways. Sometimes even like making some small lifestyle changes, like improving your sleep, reducing screen time, practicing mindfulness, all of that can actually help rebalance your dopamine system and reduce the urge for constant stimulation. And I'm talking on a neuroscience level right now. Understand that there are so many variables that play into this. While these are suggestions, like without really knowing all the variables, one may not work for you. So please understand, while these are suggestions, they're suggestions that can't be promised to have that outcome that's been described, right? Like so many different variables here. But at the end of the day, if you find yourself struggling to control your use, setting structured boundaries also are going to be very helpful. But here's, again, the problem. Us ADHDers suck at creating structure, right? Like that's a common thing for many of us. Not all, but many. So trying to create that like idea of a pause before you engage, maybe 5-minute delay, checking in with yourself emotionally, using a journal to check base. Now, all of that are neurotypical in nature, right? So what I like to suggest is, while it's great to have a check-in with yourself and it's great to create that pause, you need self-awareness in the moment to be able to create the pause. That's the freaking problem. Us ADHDers, we have deficits in our self-regulation and our impulsivity. So if somebody tells you in a therapeutic room or in a book or on a podcast or on a reel, hey, just do the pause thing. Okay, cool, dude. I need to use my executive functioning to be able to do that. Now, that's not to say there are some people that can do it, Because there is. And I think that's one of the reasons why this suggestion gets thrown out there so often without the important caveat to it, which is don't try to do this by relying on your brain to remind you. So when we're talking about pausing before you engage, place a physical cue in your environment so you aren't trying to rely on your brain that holds the deficit. So place a Post-it note on your laptop or your desk, wherever you tend to watch porn. These small interventions can build a greater sense of awareness and control. And what you're actually doing is you're leaning into self-compassion instead of setting yourself up for failure by listening to a tip that isn't really set up for your success to begin with. Okay? So I want to shift focus just for a second, because if you're in a relationship, it's going to be crucial to also have open conversations about porn use. And everyone has different comfort levels. And discussing boundaries with honesty and curiosity rather than shame is going to be key to a healthy dynamic. It can't and should never be about blame. It's about understanding each other's needs, your expectations, your concerns, being intentional in these discussions. Because that in itself can strengthen the trust and the intimacy instead of allowing for secrecy or resentment to grow. And so that ties into the, well, when should you seek a professional for their help? That's a great question. And at the end of the day, it's going to really entirely be up to you on when to do this. But I would suggest, if you find that porn use is interfering with your work, your relationships, your self-esteem, daily functioning, that's generally a sign that you're going to need some support. And the good news is that there are therapists out there who do understand ADHD and compulsivity and do have the resources and the neurodiverse friendly lens to help you through this, who won't shame you, but will help you get to the root of the issue. And if you're in a relationship where porn use is causing a strain, because sometimes it is known within the relationship and other times it's not, working with a professional that can help you and your partner navigate the conversations that are needed to have and understanding instead of allowing the conflict to arise is going to be so helpful in the process. Because therapy can be and can provide a safe space for exploring feelings of betrayal, of insecurities, or maybe you and your partner have misalignment in values or beliefs, even in the use of porn, right? And so a therapist can help couples rebuild the trust and create shared understandings. And often, compulsive behaviors are just symptoms of deeper unmet emotional needs. And therapy can be a great way to address that, identify those emotional needs that are not being met, and then figure out the blueprint on how to set you up for success within your individual and within your relationship. And I want to also speak to those struggling just individually. Individually, therapy can also offer tools to manage impulsivity, work through the shame, develop healthier coping strategies, support groups. I don't necessarily care to refer out to coaches because these days in the political climate of social media, I don't trust a coach with a 10-foot pole. That's my bias. But finding proper qualified support groups can be powerful resources as well. You connect with others, you be seen and you're heard by others. You don't feel alone. That is so important and vital and helpful. You do not have to navigate this alone. Help is there, support is there, healing is possible, but I will say it can only be possible if A, you're ready, if B, you're willing, and C, you actually find somebody that can truly address the concerns with an ADHD lens. So before we wrap up, I just want to leave you with something. ADHD makes self-regulation tough, yes. But that doesn't mean we're broken. Our brains work differently. that's okay. If you don't see it as such, then guess what? It's not going to be okay, but it is okay. The key isn't to shame ourselves and to change, but to approach this with curiosity, right? That's a dopamine winner right there, curiosity. The other big one is self-compassion. And then providing the right ramps that we need, the accommodations we need. Understanding that ADHD isn't the big bad wolf. That it is a real experience, yes. But the focus is also just as important to be placed on the social aspects and the expectations that are placed on us that may not be set up for our success. If today's episode resonated with you, I really urge you to just take an extra moment to reflect on what stood out. What's one small step you can take toward healthier habits for yourself? Whether it's tracking patterns, starting a conversation with your partner, or reaching out for support. Every step forward matters. You're not alone in this, and there are people out there who truly understand and want to help. And I know that can be hard to feel in the moment because a lot of what we see at the surface level is not support. I also just want to remind everybody that this episode can't provide the cure-all approach. It won't ever provide that. I really hope that this is just a sprinkle of help, that it allows you to have maybe a different perspective. It maybe allows you to be seen and heard in a way that you haven't been able to find yet. I just want to say thanks for spending this time with me today, listening to this episode. If you found this episode helpful, please share it with someone who might need it. And as always, it's all about setting your environment, your relationship, and your playtime up for success.